Hi. Hello, 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 hello.
Good morning on Tuesday,
Yeah.
December 12th, 2023. So,
Oh,
hey, guess what? It's the
what?
holidays.
Oh,
And by the way, his birthday was last week, which we
oh,
did celebrate heartily here in the office.
yes.
We won't say how many birthdays that is for him.
It's
But it
25.
must be the holidays because someone's got a stocking
I know.
hanging
Can you see that?
behind us. We each have a stocking actually behind us, and about every other day, if you check the stocking, there's a little something in it, and which is kind of neat. It's nothing spectacular, but it's kind of fun and it's neat. And ever since I've been here, which is now on my fourth Christmas,
Wow.
we've had these stockings, and we keep getting little things in them. And I still use some of those things, so they're kind of cool. And it's very thoughtful of the staff because someone's got to think of that stuff and put it in the stocking
I thought it was
because
Santa.
it's not me.
I thought it was Santa.
Well, yeah, or the Santa that mysteriously appears in the office and puts things in our stockings. But anyway, it is the holiday season.
Yes. So, welcome. And again, Dr. Brent Amison.
Richard Huetter.
And we are back. It's been a while.
It's been a while for
Right.
tooth talk, and well, we're going to start without teeth, but we're going to primarily focus on what we think, or at least what I think, is a good idea for this season, and we all need to think about what the season's about, but not just the hubbub, the speed of the season, the activity of the season. Uh, Maybe we need to stop and think. Let's enjoy the season, whether it's being with relatives, friends, workmates. I mean, there are a lot of stressors involved here. Some of them are induced from scheduling things. I mean, Christmas is always going to be on December 25th. That's going to happen. December 31st is going to be New Year's Eve. January 1st, it's a new year. So we can't change those things, but we can change the way maybe in our approach to them. That we have to get this done at a certain time and this at a certain time. You know what? Step back, enjoy what you're doing, enjoy maybe of what you did in the past that you can renew those kinds of traditions, and pace yourself. You know, not everything needs to be done today, and maybe not even everything needs to be done. That's the other thing to think about. You know, do you have to really do as much as you are planning to do, or be at as many places as you are asked to be? Um, Sometimes you just don't need to do all that, and is that providing any joy for you for the season? You know, if you have to do something every day, leading up until these holidays, then gosh, maybe you're not enjoying it as much as you think you should. So do that. I think that's important. You know, and the other thing, control your expectations. You know,
Oh.
you might think, oh, I'm going to get this for a gift, or I'm going to get this for a gift, and it's going to be so appreciated, and you're going to be, endeared to the person forever, or whatever, or you're going to have the best party or the best meal or whatever. You know what? It just might not happen. And so control your expectations. Not everything is going to be perfect. There's the next part of this. Expect delays, expect glitches, expect weather. You know, can interfere with this too. Now, luckily, this is what I've been seeing. You know, for the next week or two, it looks like clear sailing. You know, not even hardly rain or snow. Maybe cold, maybe a little warmer. So the trend is to not have maybe a severe winter weather like we've had in the past. I know, I shouldn't say that, but this is what I see as the trend. So, but these kinds of things can still crop up. Like I said, expect glitches, delays, things not to arrive in time that you expect because there's a lot of mail order stuff going on, and stuff either gets there too soon or too late or doesn't get there. Those are the other things that I've already experienced in some of the things I've ordered online for other people or for myself. It just isn't happening in a smooth way. So those kinds of things can happen. And then finally, I think this is, and we've spoken to this before, at other holidays, not just Christmas holidays or New Year's holidays, but it seems like every holiday, there's Valentine's Day, there's Easter, there's Halloween, it's candy, sweets, diet, just managing your diet. Everything is there, and it's available at this time of year. Like, it's the only time of year that you could ever get these things. Well, yeah, okay, but maybe again, temper your expectations or your what you are going to imbibe. Whether it's drinking, whether it's eating. There's just so many things going on to enjoy, and part of that, as I said before, slow down a little bit and enjoy each thing. Don't just eat everything because it's right in front of you. So that we did enjoy our holiday gathering for the office, which we did have already, a little on the early side, but hey, it worked out, and we all had a great time. Really, we had a wonderful time, and it was at a local restaurant. We had a really good service, really good food, yes. And that's thanks to Dr. Amison. The office, covered the bill. Hey, I'm there. So that it was really a fun time, and we have a small gift exchange, and so it was really fun, and so we're still enjoying the fruits of some of that as we speak right now. So the office is. We're doing pretty well here. I mean, managing all these things in an office scenario. There are people who need to get in, for something by the end of the year or whatever. So there are a lot of things to manage from an office standpoint as well. So we're going to switch gears now, and enough pontificating on the holidays and what it should mean to you or what it should mean to us. But I think we all need to just step back maybe and slow things down, because is it worth the stress? I guess that's what it comes down to.
And we know what stress leads to.
And stress leads to, well, and I'll be getting to that in perhaps another edition of the Tooth Talk, because we're coming to my term as a tooth talker. Tooth whisperer or talker or whatever by the end of the year, but I'm sure we'll discuss that again. But I was going to switch gears a little bit here and talk about some of the changes that I think I've seen in the decades, 4+ decades of dentistry. And I won't get to all of it today, because obviously there's a lot of things that have changed, and if you're old enough, of course, you will have lived through these changes as well as a patient. So that's you know what I'm talking about. And for those of you who haven't lived through all of it, you might be appalled at some of the things we used to do. And probably I would start with, the first thing would be infection control. Unbelievably, when I first practiced and went to dental school, we did not wear gloves for hardly anything. Unless it was a massive surgical procedure with a lot of blood, we were not wearing gloves. And so in 1986-ish or so, all of a sudden, now we have to wear gloves. Oh my gosh, who had that idea? Well, bloodborne bacteria and viruses was the cause of that. And there were people older practitioners, who said, I can't work with gloves. I've never worked with gloves. I can't do this. I can't do these little minute things that we normally do. I can't do it. Well, everybody does. And now, of course, who would think of working without gloves? But literally, blood on the fingers, blood on your fingernails, that was a thing. And we did wash our hands between patients. We really did. But gloves were just not a thing, nor masks for that matter. And now those things are absolutely routine, and that's been, 30, 40 years now of hopefully progress. Now we all have autoclaves, which are steam sterilizers for our instruments, and a lot of disposable things that we just use once and throw away, that used to get reused in the past too. Think of needles. Now, I didn't live in that time frame when needles were actually used and thrown in some liquid to be disinfected and reused again on another patient. I mean, obviously that's atrocious to think of these days, and even in my younger days, we didn't do that. And you can only imagine how dull those needles got after repeated use and disinfection, if we'll call it that. So we don't do that, of course, anymore. So that's probably the biggest change, the absolute biggest change. Wearing gowns, not just wearing a shirt or something.
Tie.
Shirt and tie and pants and street clothes all the time. Obviously, we're doing things different. So that's the biggest change I've seen. Probably the next thing that I think people recognize the most of, and I'll probably stop after this, is what we do in the way of restoring teeth, fillings. Now, it's tooth-colored fillings. I mean, routinely, absolutely everywhere was amalgam, silver amalgam that was done in almost every filling. Every filling that was done, except for front teeth, and we had a rudimentary filling material for front teeth. There were two things available, and they came in one or the other color, and that was it. I mean, it either matched or it didn't, but who cared, because it was at least white, it wasn't silver on a front tooth. So, you know, that's probably the biggest thing. And the expectation that what we do, whether it's on a back tooth or a front tooth, that it looks like a tooth. You know, the fillings that we do now are close to looking like tooth structure. And so it isn't a silver or black blob in the back of your mouth. And so you notice that. You notice when people do have those kinds of fillings, either they're older or from a country where, you know, they haven't made those kinds of changes. And you notice when people do have silver fillings. So those are the biggest changes I've seen so far, and we'll probably have another edition of this, because I know we're running lengthy here. So, you know, enjoy the holiday. And like I said, we may have another one of these next week, and we'll talk more about changes in dentistry and maybe more things about the holidays. Wow, I've been talking this whole time, and now I have a busy afternoon to go out there. My voice is shot. The patients will probably be thankful that my voice is shot, and they won't have to hear me. But I'll still get done what we need to get done.
Yes. See, there's a lot of information, very useful information.
Hopefully useful information. Just slow down, enjoy.
Remember, just relax.
Yes, pace.
I like that. Pace, relax.
Pace.
Relax.
And be ready to pivot.
That's an inside joke there. Pivot, you know.
He's got his gingerbread cup. It's not made out of real gingerbread. It is ceramic. But,
right. There's nothing in it. So.
And there's nothing in it. Thank God.
Right, exactly. That'd be a different show.
We'll have a different kind of tooth talk. And maybe we'll reserve that for another time when we don't have patients afterwards.
But yes, we really appreciate all of you watching and listening, and thank you so much for your feedback. We appreciate it. And for Dr. Brian Amison,
Dr. Richard Huetter,
have a great day.
Have a great day.
And we'll just do this.
Clink.
There we go.